We're talking with Dr. Fahmi Farah this morning, and she's in Dallas, and it's good to have her back with us. We've talked with her before. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. Farah, good morning. This is really confusing stuff that we're getting from the CDC, the various recommendations coming from various sources having to do with masking, with vaccinations. It just seems like it's almost designed to confuse us, doesn't it?
It has been a little bit confusing with the changes in recommendations. Yeah, I can see that.
Dr. Farah is a cardiologist. The latest is the American Academy of Pediatrics recommending masking in schools for everyone over the age of 2, regardless of vaccinations. Could you frame that whole discussion for us so that we understand exactly what they're talking about and why a recommendation such as this is made?
Yes. So the Pediatric Society is recommending masking for kids 2 years and above, I think it's coming from concern of the new variant that we're dealing with right now, the Delta variant. It's also in this age group where they don't have vaccine available. So these are the kids who are not vaccinated, and with previous strains, we didn't quite see the kids of this age group being as affected. However, with this new strain, it's been a little different. We've seen in other parts of the world where the Delta variant actually is affecting children and they can get very sick. And because they're not protected with vaccine, I think that's where the concern comes from, and that's probably where the recommendation is coming from, because this year the schools are opening up physically and the kids are going to be there. So I think this is just out of concern and a means of protecting them.
And of course, people are going to read all kinds of different things into it. Where do the studies come from? Where's the data? Those are some of the questions we've heard from the last couple of days. Does it seem to you like a pretty valid idea, a good idea?
It's difficult to say whether it's a good idea or a bad idea, but I feel that the Pediatric Academy feels it's kind of their only choice at this point, just because they don't have a whole lot of options available. They don't have vaccine available for this age group yet, and the schools are now opening up fully. So how do you protect these children, knowing that there's this new variant out there, which is far more contagious, which is potentially capable of getting kids of this age group very sick, potentially. So what do you do to protect these kids? It's a difficult situation all around from all aspects, no matter how you look at it, because, one thing would be, why are we opening up the schools? And we've seen there's reason and logic behind that as well, because kids have been out of school for a whole year, and it's been very difficult for these children. Education is simply not the same when they're not being taught physically at school. It's been very difficult for the parents. So there's not an easy solution, and there's not a black and white answer to this.
There's a lot of question about trust as well. Do we trust the CDC? Do we trust this group or that group? And sometimes the contradictions that have come out have harmed the cause a little bit, I think. And so those concerns are things that have to be overcome if we're going to really settle in on battling this COVID variation, the Delta variation. That being the case, is the Delta, is that something that was anticipated?
Before the Delta came on, there were some concerns about mutation because we were seeing other forms of variants already. And the vaccine not being available in other parts available as widely as we were fortunate to have here in the U.S. And we do live in a very global community now. So, yes, to answer your question, variants were of concern, and Delta variant certainly has made both the scientific community, the medical community, very concerned because of what it was capable of doing in other parts of the world, specifically India, in a very short period of time. So the fact that our numbers are climbing again, that is of concern.
I want to draw on your background as a cardiologist and talk about the effects long term of having had COVID, of the way that the disease attacks and can bring people down, and then the long-term ramifications on in your case, heart patients that you deal with so often, or other people who have those various medical issues in their backgrounds. Are we finding that COVID-19 is particularly troublesome for people who have those long-term health effects?
Yes, it can have detrimental effects in people who have, pre-existing conditions like heart disease prior to getting COVID, and risk factors such as diabetes, high blood pressure. Those people tend to get a little bit more sick when they get COVID-19. And I'm talking about even the variants that came before Delta variant. And on the other hand, there are some folks who have gotten COVID-19 infection who did not have any pre-existing conditions, and even they were very sick. There is a group of people that you've heard about, the COVID long haulers. We are seeing a lot of those patients who have recovered from their COVID-19 infection, but they're having lots of problems going forward. Life is just not the same anymore. I have young people. I've had some people in their 20s who have heart problems as a result of COVID. They have arrhythmia, atrial fibrillation. I have several young people who had such terrible lung infection that they're now in chronic respiratory failure, meaning they're requiring oxygen even a year after recovering from COVID-19. So for a 20-year-old to be on an oxygen tank, life is just not the same, and there's no telling when they can come off of this oxygen. So yes, it is a true fact that some people who have been affected by COVID-19, even despite recovering from COVID-19, they're dealing with many other health problems for months to over a year now.
And now bringing the conversation back around to those schools, those people who work in schools are going to be mixing with students. And so you have teachers, you have staff members, you have custodial staff. All of the people, the adults who are there, might bring their pre-existing conditions with them wherever they go. And they could be particularly vulnerable if a student population is able to mix with them, and there could be a really dangerous situation for them, could there not?
It could, yes, and that's why there's been a push for vaccination. Strictly from a scientific, from a medical standpoint, we have seen that the vaccines that are available here in the U.S. have been effective against the variants, and they are saying that it's quite effective against the new variant, the Delta variant as well. And so one good way of tackling this virus is vaccinating as many people as we can. However, that is not an option for people who are of this age group that we're talking about today, because they're not eligible for that vaccine. They're too young for that. But they could get sick themselves, and they could act as a vector to transmit the virus to other people when they go home, to their parents and relatives and friends, and even the teachers and staff members who they're dealing with on a day-to-day basis when they go back to school. So that's why that's when other forms of protection becomes important, such as masking.
We're talking this morning with Dr. Fahmi Farah. She's a cardiologist in Dallas, Texas, and as we are having the conversations here in our area about masking of students in schools, and of course IUP with its new guidance this week, our local university as well, talking about that. This is a real issue that is going to probably change and maybe change several times before the start of school in just a couple of weeks. It's one of those stay tuned type of situations, isn't it?
It is. And, it has been an evolving pandemic. We've gone through so many different phases, and we have had to adapt to the situation. And that's just how it is, and that's how it needs to be, in my medical opinion, because, when things get bad, we need to do everything we can to prevent it from getting worse and take the safety measures. And when things are a little bit better, if we can be a little more relaxed, to allow people to have a little bit easier life, then that's what needs to happen. And I think that's where the changes of rules are coming in, and it is confusing for many people. But while it is confusing, I think we need to all just work together and have a cooperative mindset, just because it is a difficult situation. It's something we've never dealt with before. So obviously, the solution and the methods that are coming along as we're going through the different parts of the pandemic are evolving as well. So we just need to keep that in mind.
Well, we thank you for helping us to understand a little more clearly this whole situation. Dr. Fahmi Farah, have a wonderful day today.
Thank you. I appreciate it.